Good morning, you guys. It is time for your health check. As of January 15th, 4% of Texans have received a COVID-19 vaccine. As many as 21 million more Texans are waiting their turn. We've got a long way to go toward what we call herd immunity. In the meantime, there are ways to be smart when it comes to navigating this virus. Joining me this morning is Dr. Claire Bocchini, infectious disease specialist from Texas Children's Hospital. Thank you so much for joining us. I'm wondering, where do we stand regarding pediatric COVID illness in Texas?
Well, thank you for having me. That's a great question. And in my experience, we are certainly seeing a surge of pediatric cases, just like we're seeing just a terrible surge of adult cases. Kids tend to have a more mild illness, but that being said, in Texas, they have reported a minimum of 500, children who have required ICU care and 35 deaths from this disease. So, certainly more mild disease than adults, but we're seeing a lot of it.
So we've seen COVID-19 outbreaks in daycares and in schools here in North Texas originating, we've heard, from adults. So you've said that adults' vaccinations could offer sort of another line of defense for children. Can you explain how?
Absolutely. So the vaccines aren't available for children yet. It's going to take some time, but we know that if we protect adults, that's going to end up protecting children, since children are getting a lot of, majority of the cases of kids are coming from, the adults are transmitting to children. And we also know that, if we are able to protect adults, children are going to stop losing family members. Their parents will be able to go back to work. I think overall, it will really make a huge improvement in the lives of children if we can get adults vaccinated.
And when do you anticipate seeing childhood vaccination in particular for COVID-19 as a possibility, given where we stand sort of with clinical trials in adolescents, or I guess now kids as young as 12?
You're exactly right. We do have trials going on down to children age 12 and higher. So it's going to take time. I definitely, hope that we have the vaccine available for, children over 12, but, within this calendar year. But for younger kids, it's going to take more time because we haven't even started, the trials down to age 5 and younger. So it's going to take time.
And Dr. Bocchini, one final question. You're going to be at a meeting at 11 o'clock this morning to examine vaccine efforts as part of a team. What do you expect to be discussed? And do you think that there's any action or change that might come from this meeting specifically?
I hope so. So, I'm very excited to be part of this meeting later today. There's two big, agenda items for this meeting from my standpoint. The first is that, we have two vaccines right now, the Moderna and Pfizer vaccines, that are very safe and very effective. And we just want to make sure that the data, the science behind these vaccines is fully available to the public. We want the public to feel comfortable accepting these vaccines because they have been studied just as well as other vaccines, just very quickly because of all the, the money that's been put into the trials and the people who've been willing to participate in the trials. So we're very confident in the data, and we really want to have people feel comfortable accepting the vaccine. The second big part of what we're hoping to talk about today is that we need to make sure that the vaccine is distributed equitably across our state. Texas is actually doing a pretty good job with getting the number of doses that they have out. We actually have given more vaccines than any other state, but we certainly are seeing patients who are struggling with getting, with finding the vaccine. And we take care of a lot of patients who have a lot of barriers to getting the vaccine. People who are living in rural communities, people who don't have transportation, people who don't have access to the internet to sign up for a vaccine. So while we really thank the Texas State Health Department and public health officials, because I do think, it's a huge undertaking, and they've done a really, good job with what they've had. My hope is that we continue to evolve and we do an even better job, and we especially make sure that we're not leaving anybody out who needs the vaccine. So those are the two big things that we're hoping to cover today in the meeting.
Well, we will certainly keep in touch with you and keep our eyes sort of on the meeting. And thank you so much, Dr. Claire Bocchini, for your efforts and for joining us this morning. We appreciate it.
Thank you so much for having me. Bye-bye.
All right.